Welcome back, everybody, here on this Monday morning. Lions coach Dan Campbell will be giving an update this afternoon and hopefully a little more insight on Aidan Hutchinson's broken leg that he suffered just into the third quarter yesterday as he was sacking Dallas's Dak Prescott.
And while we wait for an official update from the head coach, we do want to talk with Corewell Orthopedic sports surgeon Dr. Joseph Guettler for a better idea of just how severe Aidan Hutchinson's injury is. Thank you so much for joining us, Doc.
Good morning.
So give us some perspective. You've seen injuries like this. We're hearing that it's a tibia fracture. How severe is it and how long will it take to recover?
Well, keep in mind that I'm not directly involved in his care, but this is what I know. It looked like, when I looked at the replay on TV, like a typical tibia fracture. We call them a tib-fib. Pretty serious injury. I know that he was taken to emergent surgery. That usually, if it's in the mid-shaft of the tibia, involves an intramedullary nail to fix and stabilize the fracture.
Doc, I've heard other doctors say in these situations that sometimes it's better that there was a break rather than a severe sprain or a ligament tear or things like that. What kind of insight can you give us on that?
There is some truth to that, but keep in mind we first have to get the bones to heal. Secondly, there's still a pretty extensive rehab period because of all the atrophy of the muscles, tendons, and ligaments around the fracture.
Yeah.
Well, he is an elite athlete. He's young. I have to think that that has to help him. Of course, he also gets incredible care by the doctors and all the rehab that will take place there. What could be his outcome if the injury and the repair to it is as you described?
I think the outcome is going to be excellent. Certainly, we're looking to see him next season. Generally speaking, this is a 3 to 6 month recovery. But hey, we all love Hutch, and we're hoping and praying for a speedy recovery. And he has the best doctors and team around him in the world.
Yeah, and I think sometimes just when you think, oh, there's no way somebody can return, sometimes we've seen some of these guys come back from a torn Achilles in the same season, which just makes you think this is insane. Is there anything about this injury, Doc, that you think people either don't know or the biggest misconception?
I think it's fairly straightforward. I mean, the bone's broken, it gets a nail, and it should, God willing, it's going to heal uneventfully. He's going to rehab. He's a young, healthy guy, and he should do great.
And you say 3 to 6 months, so if it's somewhere closer to 3, he might be able to return before the postseason is over? Wishful thinking?
We will have to see. But generally speaking, it's a minimum of a few months of overall recovery.
Yeah, and then not to mention the rehab, as you were saying, that goes into that. Doctor, we really appreciate the insight this morning. I know you don't have the intimate knowledge of it, but just when you see it, we appreciate you being able to kind of break it down for us and show us what it all means.
My pleasure.
Dr. Joseph Guettler from Corewell Health.
Yeah, nice to get that perspective, but of course this is just like day one of, just the reality setting in that he's going to be out for a while.
Yeah,
so we are hoping for a full recovery and that he's faster, better, stronger.
And while we have high hopes, we think this season, this is the year. Also, you got to think in terms of his whole career. He's got a long one ahead of us, and we want him to come back.
He's
100%.
a young guy. Yeah, so that does give us some optimism for sure that he'll recover, but it's going to take a little while.